Hello, everyone, and welcome to RX Explained. I'm your host, Emily Carter. Today, we're talking about a fascinating new treatment for Parkinson's disease that's showing a lot of promise in clinical trials. It's called Bemdaneprocel. To understand how Bemdaneprocel works, we first need to understand a little bit about Parkinson's disease. Parkinson's is a neurodegenerative disorder, which means it affects the brain. Specifically, it leads to the loss of dopamine-producing neurons in a part of the brain called the substantia nigra. Dopamine is a chemical messenger that helps control movement, so when these neurons are lost, patients experience symptoms like tremors, stiffness, and difficulty with balance and coordination. For decades, treatments for Parkinson's have focused on managing these symptoms, but they don't address the underlying cause: the loss of those crucial dopamine-producing cells. This is where Bemdaneprocel comes in. Bemdaneprocel is a cell-based therapy. In simple terms, scientists take pluripotent stem cells, which are like master cells that can become any type of cell in the body, and guide them to become dopamine-producing neurons. These new neurons are then surgically transplanted into the patient's brain. The goal is for these new cells to replace the ones that have been lost, to restore the brain's ability to produce dopamine, and to ultimately alleviate the symptoms of Parkinson's. So, which patients might benefit? Bemdaneprocel is being studied in patients with Parkinson's disease who are experiencing motor symptoms. This includes the tremors and stiffness we mentioned earlier, as well as what are known as off periods. Off periods are times when a patient's medication isn't working well and their symptoms return. In clinical trials, Bemdaneprocel has shown some really encouraging results. Patients who receive the treatment have seen a reduction in their off time, meaning they have more time in the on state, where their symptoms are well controlled. They've also shown improvements in their motor function overall. So what are the key benefits we're seeing? First and foremost, it's the potential to not just manage symptoms, but to actually restore function by replacing the lost cells. This is a huge step forward in how we think about treating Parkinson's. Now, with any new treatment, it's important to talk about the potential side effects. In the initial clinical trials, Bemdaneprocel has been well tolerated. There have been no major safety concerns related to the cell therapy itself. Some patients have experienced side effects related to the surgical procedure, which is to be expected with any brain surgery. The most common side effect reported in later trials was insomnia, which in most cases resolved within a week. Bemdaneprocel is administered through surgical procedure. The new dopamine neurons are transplanted directly into a specific area of the brain. The dosage, meaning the number of cells transplanted, is still being studied to find the most effective amount. Patients who receive the transplant also need to take immunosuppressant medications for about a year to prevent their body from rejecting the new cells. It's important to remember that Bemdaneprocel is still an investigational therapy. It's not yet available to the public. However, it has received Fast Track and Regenerative Medicine Advanced Therapy designations from the FDA, which should help to speed up the review process. So, what's the bottom line? Bemdaneprocel represents a new and exciting approach to treating Parkinson's disease. It's a testament to the incredible potential of stem cell research. While there's still more research to be done, the initial results offer a lot of hope for patients and their families. Thanks for joining me on RX Explained. If you found this video helpful, be sure to give it a thumbs up and subscribe for more content like this. See you next time.